Pursuing a profession as a dentist is both complex and challenging job. According to Standar Kompetensi Dokter Gigi Indonesia, a dentist should be able to do a minor surgery procedure in hard and soft tissue of the mouth. Therefore, being able to do suturing technique after minor surgery is essential for a dentist.
Hai, Dokter Yoga.
Suturing is a joining process of tissue using a needle and a suture material so the tissue bind together and heal.
The goals of suturing is around healing to decrease the chance of debris accumulation, prevent post-operative bleeding, protect underlying tissue from infection, restore full function of the tissue, and re-establish anatomical position.
What you need to prepare before suturing are: to hold the needle holder, place your thumb in one ring and your ring finger in the other. Your index fingertip is placed on the hinge. Grab the suture needle in the center of the needle. The needle should be a few millimeters from the needle holder tip when grasped. The needle should enter at the right angle to the tissue surface when penetrated.
Interrupted suture, the simplest and most frequent use, may be used in all surgical procedures of the mouth. Insert the needle 2 or 3 mm away from the margin of flap, twist your wrist, exit at the same distance on the other side, wrap suture twice around the needle holder, tighten the two ends to create a double knot or initial knot. Create a safety knot by wrapping the suture in the counterclockwise direction and tighten it. Cut the suture 8 mm above the knot.
Continuous interlocking suture. It is indicated for superficial long ones, but if it breaks, the whole suture will be rendered. Create an initial knot, cut off the free end suture. Use the needle bearing suture to create successive continuous sutures. Pass the needle through a loop created before penetrating to the tissue. For the last suture, the loop created serves as the free end of the suture. Tighten the two ends, create the surgeon's knot.
Matrix suture include both the horizontal and vertical. A horizontal matrix suture can be used in cases which require a tissue closure over osseous cavities. The vertical matrix suture can be used when suturing over a dead space such as the case cavity, antral fistule, and other deep incisions. Insert the needle from the top of the first side of the tissue, come from under surface to the top of the second side of tissue. Insert the needle in a line on the top of surface of the second side, then coming from under surface to the top of the first side of tissue. Then, tie the knot. The suture enters and exits the tissue in a winding maze patterns.
Figure of 8 suture. This technique is effective to close the tissue of an extraction site, provide a barrier to dislodgement of a blood clot, stabilize materials placed into the extraction site. Insert the needle through the first side tissue, then the opposite side from the bottom to the top surface. Advance just a little bit further along the tissue. Insert the first side from top to under surface just across from the suture on the other side and come out on the under surface of the tissue. Now enter the under surface of the other side even with the first suture and come out on top. Suture can now be tied.
Now, we already learned how to suture a soft tissue of the mouth. We hope this video could give you advantages as a future dentist. So, don't forget to practice more. Terima kasih. Bye-bye.